On this episode,
This is as far as I can get it, and it should come up here.
will Scott be able to fix young husky Reggie's shocking hip problem?
Every day must be a challenge to get through. And it's so upsetting.
Little Toby is desperately unwell,
His heart is not in a good place.
but Arvid fears surgery to help him could be fatal.
With his heart condition, Toby could die under anesthesia.
This is really, really terrible.
And a challenge for Rob with a badly injured and very feisty macaw.
We may have to amputate the wing.
You make my world a better place.
Come on, there's your girls.
I can depend on
Come on in, buddy. Good boy.
On a frosty morning in Isleworth in the UK, Peter and 12-month-old Reggie are braving the cold to head in to see Scott.
I've always wanted a husky. My daughter wanted a husky as well, so I did have my arm twisted into getting one earlier than I would have, but now I've got them, wouldn't have anything else. You just want to get out with them and spend time with them. Weekends, over the park, running around with them. It's great. It's your best friend.
But recently, Scott diagnosed the young husky with hip dysplasia, a degenerative condition inherited from birth.
I can only just exercise him, keep him on the lead. We're not allowed to let him run, obviously, in case he does himself a mischief, but he has to have a double hip operation. Hey, who's this? Who's this? It's quite gutting, the fact that he's such a young dog. He should be bounding around. We hope that once he's had the operation, that will be the case, that he's running around. Come on in. Good boy. Here we go. Come on in.
Today, Scott will determine if the young husky is ready to undergo such a major procedure.
Yes, good boy. Yes.
How's our beautiful blue and brown-eyed boy?
Yep.
Why are you looking so nervous? What's the matter?
He's very upbeat, obviously.
Not right now, you're not.
Yeah. No, he's very nervous.
He's going, I can smell that.
Yeah, he knows something's going to happen.
Let's get you in the console room and have a look at you, my boy, my most beautiful boy.
Peter's a real legend. He's just one of those guys. He's just salt of the earth. You know, he's just someone who you instantly like. He's walking like an old man
Yeah, very weak in the back.
and lost even musculature from when I saw him just a month ago. You know, he had some quads on him, didn't he?
Yeah, I've noticed with spinal, he's curved. He's very, very thin on the back end.
Yeah. He's so lean. I'm incredibly shocked at how debilitated Reggie is. This should be a young dog bouncing around the park, bouncing around the vet practice, and yet he's quite sullen, he's painful, he looks like an old dog. So I'm gonna extend the saw a bit. Okay, so just wanna see where we are. All right, baby. All right, so you can see I can't even get it. This is as far as I can get it.
Yep,
And it should come up here.
yep.
Hip dysplasia is a degenerative condition of the hip joints. And it means that the hips almost fall out of the socket that they're designed for. It's incredibly painful, and in a lot of cases it requires surgery. Got so much worse since I last felt it. Every day must be a challenge to get through.
Yeah, but there's no quality of life. So he, like you say, he has seriously gone downhill.
Get you all fixed up, okay?
In Atlanta in the USA, Andrea has come to see Arvid about her 15-year-old poodle Toby's persistent cough.
You'll feel better after.
We adopted Toby when he was about 2 years old. As Toby has gotten older, he's developed a lot of different conditions. He was recently diagnosed with pneumonia, but Dr. Edward was able to resolve that with some antibiotics.
At first, medication seemed to fix the debilitating cough, but now it's as bad as ever.
You're okay.
Well, hello, Toby. How you doing, buddy? Don't look too happy to see me. Don't look too happy to see me. How you doing? So Toby's this little old man, sweet guy, But the problem is he's been having this chronic cough that we've been trying to resolve for the past few months. And he got better for a little while, but then the cough came back. I know, man, I know. We're gonna get this cough taken care of. So let's see here. But you can see those teeth there. Yeah.
They're rough.
Yeah, and this gum, so you can see it's a little painful. You see how he jerks his
He
head?
doesn't like it, yeah.
Yeah, it's a little painful. With the condition that his teeth is in, it seems that he has some mouth pain. I know you say he's been pawing at his mouth.
Yeah.
So I'm thinking that cough has a lot to do with this dental disease. A lot of those teeth are probably gonna have to come out.
Yeah. Toby is family. So he's not just our dog, he's our family member. So when he's hurting, we're hurting, and we just want to do whatever we can do to make him feel better and to make him have good quality of life.
All right, so I'm gonna show you his radiographs.
Okay.
Toby desperately needs surgery on his diseased teeth, but a long-standing heart condition has so far prevented that.
You can see how big his heart is. He has a moderate left atrial enlargement, but he also has severe enlargement of the left ventricle. All right? His heart is not in a good place.
Yeah.
All right, and we know that putting him under anesthesia with his heart condition, how risky that is.
Toby's surgery is definitely a risky procedure given his age and given his condition. It's definitely a lot to think about, and I am worried.
Are you sleepy? Oh.
Andrea loves her Toby and will do anything for him. So now we have to come to this decision, whether we put Toby under anesthesia to do the teeth, because there is a very good chance that Toby could die under anesthesia.
So you can see I can't even get it. This is as far as I can get it. And it should come up here.
He has seriously gone downhill.
In Isleworth, Scott and owner Peter are shocked at how much Husky Reggie's hips have deteriorated.
I mean, it's heartbreaking. Hip dysplasia can affect puppies as young as 4 months of age, and you and him have just been dealt the real short straw on the genetics when it comes to this condition. And obviously what we've been doing, as hard as it's been, is we've been waiting for him to get to full size and weight, because we can't jump in and give him any kind of surgical intervention until he's fully grown. And so unfortunately we have had to wait, and I appreciate that. It's so upsetting. The plan for today for Reggie is to re-x-ray his hips and just have a look and see where we are. What I'm hoping for is that I'll see that his growth plates have fused. So Reggie is now full maturity, and that means that we will be able to put him forward for surgery. All right, Peter, well, I'm gonna take him downstairs now. I'll be carrying him. I won't be letting him walk down for obvious reasons.
Okay, no
do you wanna
worries.
Give him a little kiss.
Yeah.
Hey, Daddy's
see you
gonna
later.
say goodbye.
Be a good boy. See you soon.
Peter's handling the situation well. He's a pragmatist, but at the same time, he knows his dog isn't right, and he is quite worried about what the future might bring. Hi, guys.
Hello.
I've got very handsome Reggie. Say hi, Gina.
Hi, sweetheart.
I love this dog.
Vet nurse Gina will assist Reggie's x-ray.
But his hip dysplasia is really catching up with him now. He was diagnosed 4 months of age. It's just heartbreaking. You can see his spine is raised because he's using his back to pick himself up rather than his hips.
Yeah.
Hip dysplasia is something that we see more commonly in large breed dogs because they grow quite quickly in a short space of time, and these long bones can then show more abnormalities than if they're smaller dogs. And also they've got more weight to bear on the hips. So look how close his ankles are sitting there. You can see he's sort of almost standing like a duck. And then just the muscle loss is insane. Like he's just sucking in here, and then this flexion of the spine there. I mean, he's just got absolutely no muscles. You're just a bag of bones. Not very good bones at that. I'm incredibly anxious to move forward with Reggie's treatment plan, and that is to get him booked in for surgery.
Ready?
Yeah.
Yeah. X-ray.
Jeez. How is he even walking at all? Look at that. I didn't expect that I was going to be impressed, but I'm actually horrified. So that's the femoral head, and you can see all this massive bony change here. It's all just breaking down. But there is also signs that there is unhealthy bone development in his knees as well. He's got problems in all of these joints, which may mean he can't continue. You know, maybe that we have to let him go. I expected that his hips would have deteriorated, but now there's changes in his knees, in his pelvis. There's just changes everywhere. And this dog, I just don't understand what's going on. Hi, Peter. Do you want to come on in?
Yep, no worries.
Come on, I've got your boy.
Scott must now tell worried owner Peter that his husky is in a very bad way.
I'm thinking that cough has a lot to do with this dental disease. A lot of those teeth are probably going to have to come out.
Yeah.
In Atlanta, Andrea must decide if Arvid should go ahead with dental surgery on 15-year-old Toby that could place the poodle's life at risk.
With him having dental disease, it can lead to secondary heart disease like he has, liver disease, kidney disease. Without the procedure, he's going to continue to be in pain. He's going to continue to have that bacteria going through his bloodstream, which is going to further cause heart issues. He's just going to feel bad for the rest of his life. And with his heart condition, that's what makes it a little more scary.
If I know he doesn't have a lot of time left with us, but for the short time that he does have, I want to make sure that he's comfortable. I think it's the best thing we can do as far as like quality of life. So let's do it.
Let's do it.
Let's do it.
Let's do it.
You ready?
You ready to go through this, man?
Not really, but it's okay. Even though there's a lot of risk to this procedure, Toby has been such a great pet and friend to me. I think this is the least I can do to help him live a comfortable life. You're gonna be okay.
It's hoped removing Toby's diseased teeth will prevent several other serious medical conditions, as well as curing the aging poodle's hacking cough.
All right, Toby. Say night-night, and we'll see you in a minute, all right? Get you a good sleep. Time is of the essence. We don't want him under anesthesia for a long period of time with his heart condition because his life depends on it.
First, Nurse Jenna removes years of built-up tartar from Toby's teeth.
All right.
Then Arvid gets to work extracting those teeth that are too far gone to be saved.
And you can see there's pus and debris that's coming out of the sockets there. And you can imagine swallowing this bacteria, inhaling this bacteria. You can see how. So as I'm doing Toby's teeth, I'm thinking to myself, wow, this is probably one of the worst cases of dental disease that I've seen. Both canine teeth have created oral nasal fistulas in the mouth, causing a hole through the oral cavity into the nasal sinus that can be very problematic. So food, particles, all kind of things are getting up in this hole, and that's also causing infection, not just in his mouth, but throughout his whole body. It decreases their lifespan, causes a lot of pain, affects other organs. So I'm gonna have to fix that, which is not good because that means he's gonna have to be under anesthesia longer than I anticipated. And of course, the longer he's under anesthesia, the higher the risk of him not making it through, so.
But as Arvid begins repairing the hole in Toby's gum, the little dog's condition suddenly deteriorates.
So this is why I gotta get Toby off the table because the heart rate is dropping.
West of Sydney, it's the end of a long day at Rob's Vineyard practice.
Sit, Sarah.
Rob, before you go, Luke just needs your help with Zazu the macaw.
Okay.
But an emergency has been rushed in, and Rob won't get to go home just yet. A 13-year-old macaw with an injured wing needs his urgent attention.
Come on. This clinic has provided 24-hour service since it started in 1980, and we continue to do that. Here we are. I can't tell you the number of dinners that every vet has missed, the Christmases, birthdays, but the animals have to come first. It's very difficult. It's one of the most difficult professions from that point of view.
Vet Luke is also working back late to help with the lively patient.
Yesterday, apparently, Zazu was fine. She was on the perch, both wings symmetrical, and when the owner came home, found one wing drooping, knew that something bad had happened. We're both worried about nerve damage. It's not one of those things that you think, oh, I'll just shut the door and I'll see you tomorrow. We're going to do something now. Zazu's squawking at me right now because she's just so upset. She's worried and she's already feeling pain and discomfort with that wing that's drooping down. Here we're going to try and restrain her as carefully as we can and as quickly as we can and get her anaesthetised so she doesn't go into shock. You can feel that bone on bone grating.
Yeah.
So there's definitely a fracture there. But she feels like it's all the way down, Luke. It's a bit of a worry, isn't it? My big worry is that she's caught that wing and maybe torn it underneath. That means she's torn the nerves to that wing, and then we may have to amputate the wing. We'll x-ray it and let's see what's there.
X-ray.
Let's have a look. Oh mate, we're in a world of hurt. This is really, really terrible. Oh, I've got 1, 2, 3, 4. We may have 5 fragments in that radius, so I don't know how we're going to put that together.
How are you, eh? Is he doing better? I mean, obviously, you didn't say it was good the first time round, so...
In Isleworth, Scott now has the grim task of telling Peter that his beloved Reggie's hips are far worse than first thought.
Yeah, unfortunately, it's gotten quite a bit worse. The hips look horrific. They are barely holding in there. I'm amazed that he walks at all. But unfortunately, the abnormalities don't stop there.
Okay.
In that he now has changes to both of his knees as well. It's kind of moth-eaten looking bone, which can be caused by a number of different things. The worst case scenario is of course some kind of cancer, which is possible. You would hope it's not likely because he's such a young dog. So this is his pelvis and these are his back legs.
Yeah.
Can you see this?
Yeah, oh God, yeah.
The other possibility is that he is suffering with osteoporosis, and it's usually because of a lack of calcium.
Okay. Is this a deficiency within the dogs themselves?
It's within their diet generally.
Their diet, okay.
Yes. Do you add any bone into the food at all?
Not really. Well, only duck neck.
Okay.
They have quite a bit of duck necks, so we give them that.
I'm looking at supplements to basically make sure that he's definitely getting the right amount of calcium that he needs.
No worries.
Yeah.
Yep.
Peter is going to do his very best to throw as much calcium down his dog's throat as he possibly can, in the hope that that will help to stave off any further changes to his joints.
Scott also plans to take Reggie to see specialists to get more information about the young husky's deteriorating bones.
The one bit of good news is that his bones have finished growing. You can see the growth plates have fused, and so he is in the perfect position to have surgery to correct his hips. It's just whether the specialist believes that it's appropriate at this time. There you go, Peter. Take it easy.
Lovely,
and we'll be in touch.
Thanks
All
a lot.
right, mate.
Cheers.
All the best.
Thank you.
Bye,
Come
buddy.
on in.
Reggie is a basket case. Everything that could be wrong is going wrong. Multiple joints, looking terrible. This is a really unhealthy dog. And as his vet, I'm really worried for him.
Come on then, buddy. Off we go. He will be fussed by all the family when we get back, so yeah, no doubt. And he hasn't eaten today, so he will be spoiled. Come on, this way. Come on, this way, buddy. Good boy. Good boy.
So this is why I gotta get Toby off the table, because the heart rate is dropping.
In Atlanta, Arvid is battling to save 15-year-old poodle Toby, who's crashed during major dental surgery.
Jen, Can you bring the needle holders with you as well? His heart rate had dropped down to like 80, and it started at about 150. So we're gonna give some medication to get the heart rate back up. We're going back up now. So I gotta get Toby off the table. I'm gonna have to start moving. It's now becoming very scary because I know that there's a good chance that Toby may not make it off this table. And there's still a lot left to do in his mouth. I think we're running out of time. There's an oral nasal fistula here. So it's caused severe bone damage all the way into the nasal sinuses. Well, he's been dealing with that for a while. And I think that's a large in part of his coughing, his heart disease. That's why we're starting to see blood coming from the nose, and that's just a result of how infected these teeth are. All of them are gonna have to come out. All the teeth are gonna have to come out. So we're still finishing up one side. We still have a whole nother side to do. Chances are he's gonna have an oral nasal fistula on the other side that I'm gonna have to create a flap for and close as well. You see that gaping hole?
The same serious defect on the other side of his mouth
Got to drill some of the bone back here.
means even more risky time under anaesthesia for an elderly dog with a perilous heart condition.
This is probably one of the worst fistulas that I've seen. Got the teeth that needs to come out so far out. Repaired the fistulas. Now we're going to get some dental x-rays, make sure everything else looks good beneath the gum surface, and if everything looks good, we're going to wake him up.
But before they can begin x-rays,
Not hearing that heart rate.
there seems to be another problem with Toby's heart.
Girl, come on. Come on.
In Brisbane, Sally from Happy Tales Animal Rescue is bringing in 8-year-old River for a health check with Alison.
Hello. This is River.
If the stunning husky cross gets a clean bill of health, she'll be ready to be adopted by a loving family.
Good girl. River came to Happy Tales recently. She was surrendered by an owner who unfortunately was facing homelessness. Good girl. Before any animal goes up for adoption, we get a full health check and we make sure that any underlying issues that we know about, we can get them fixed before they go to their forever home.
Hi Sally, how are you?
Hi, good, how are you?
This must be the gorgeous River.
This is River.
Hi River, nice to meet you. Would you like to come on into the console?
Come on.
She is absolutely gorgeous. Come on River. Come on. Oh, we're a bit unsure.
River, she's absolutely beautiful. Her temperament is amazing. She's really calm. So I'm really keen to see what's up with her today.
So how's she been at home? Doing all the normal things?
Yep, eating and drinking well. She's such a happy dog. She has such a gentle, sweet nature. We have noticed some limping. I'm not sure if it's one of her back legs, particularly when she gets tired.
Could even be arthritis at this age. So I'll definitely give that a checkup. But what I might do is give her a full physical exam, see how she's going, and then I'll get down to that sore leg.
Okay, let's listen to that heart.
Sounds perfect. Okay, so have you got anyone in mind for this lovely girl?
We do. We've got a couple in mind to foster her. She's a lovely dog and I think she'll make a lovely forever dog for somebody.
Oh, I mean, her temperament's amazing. She's going to find a great home and great owners. So shall we have a feel of that back left leg? Good girl. Oh, there we go, yeah. So she's definitely more willing for me to lift the left leg than she is the right leg. Like, she really is reluctant to me lifting up that right leg, and that's because she has to shift her weight onto the bad leg, the left leg. So just doing that exam, you can tell there's something going on. Why is she not wanting to weight bear entirely on that left leg? So what I really want to do is give her a little bit of sedation and anesthetic, and that allows all her muscles to relax, and I can really move that joint and see if there's anything wrong with the ligaments, particularly in the knee. And the other thing we might as well do while she's under anesthetic is do a full leg x-ray and just make sure there's nothing like a fracture there.
Alrighty, you say bye to Sally?
Be a good girl.
Say bye, Sally. Right, we'll speak to you shortly.
Thank you.
Come on, this way. Good girl. I checked River over and generally she's in good health, but she's definitely guarding that left back legs. So I'm worried something's going on with that knee or that hip. So we really need to do more diagnostics to get to the bottom of it.
Not hearing that heart rate.
In Atlanta, Arvid is worried his elderly patient Toby has crashed for a second time during risky dental surgery.
So I want to get Toby up off this table, quick, fast, in a hurry.
But it's the heart rate monitor, not Toby's heart, that has stopped working.
Are you kidding me? Now the monitor goes out. And of course, I've got to hear that beep, beep, beep. Because when that stops, no pun intended, but that kind of makes my heart stop.
Thankfully, it's a simple fix. The electrodes connected to Toby's chest weren't moist enough to send electric signals to the monitor.
That monitor, you always want to hear it in the background. That just kind of keep you sane. So I kind of lost my sanity for a minute there.
Reassured Toby's heart is still beating, Arvid and Janet take dental x-rays to see if there are any more teeth that need to be removed.
Almost like the tip of the iceberg effect. Just because a tooth looks healthy on the outside of the gum doesn't mean it's healthy underneath. That's the top layer.
It's the very last.
After taking the x-ray, you can see that beneath the gum surface, there's bone loss and actually an abscess tooth there. That particular tooth will have to come out as well. You can hold this lip up for me real quick. We ended up extracting 14 teeth, which, yeah, I know it's a lot of teeth, but it was a necessity in order to cure his dental disease and everything that's going on with his pain and all of his other issues as a result of the dental disease.
Toby's life-threatening surgery has finished not a moment too soon.
That heart rate is starting to come down again. We're going to only get so many chances with that, so we're about to get him up.
Did you do it when you hit? Yeah.
Good girl. She's amazing. So what's her history? She's
8-year-old, surrendered.
In Brisbane, Alison has called in experienced orthopaedic surgeon Jeff to help try to get to the bottom of why River is limping.
She's got some lovely foster carers lined up.
oh, she's a beautiful nature.
She's so good.
I'm very glad we're fixing you, River.
Good night.
X-rays should indicate if there's any serious damage to the 8-year-old's hip or knee joints.
Yep. Perfect.
So what do we have here?
So the core problem with this knee is that instead of the shin bone having a flat top, it's got a sloped top. So when she's running, every step is loading that cruciate ligament. And over 7 years, it's just pickled itself and then snapped. So now when she's walking, it feels like she's stepping on a slippery banana. It just slides all the time.
Dr. Jeff and I have a look at the x-rays and we can clearly see that the angle of that knee is not right, which explains why that cruciate ligament was very weak and was going to snap at some point. Unfortunately, the surgery that River requires is quite costly. River doesn't have an owner, River doesn't have a home, so there's no one that we can really ask for these funds. It really relies on the rescue organisation.
In the UK, Scott is taking Reggie to see specialists to investigate the young husky's hip degeneration.
We're just going to look into his condition. He has got some really weird symptoms. He's got some really weird findings on his x-rays. And so today is about going to specialists, seeing the medical picture, doing what is called a CT to get a better image of Reggie and understand exactly what problems that we face together.
There we go. Come on then. That's a good boy. Come on then, come this way. Hi guys, how you doing?
Come here, handsome boy. Up you go.
There you go. Such a clever boy.
All right.
Well done.
He's got the most beautiful nature.
So well behaved.
Yeah, he is.
Vet specialist Nora will do a thorough examination of Reggie.
Yeah, he's actually overall quite lean. He's very bony.
Yeah, he's not thriving. I think that can be very clearly said.
Absolutely, yeah. He looks like a 12-year-old dog instead of a 12-month-old dog. But you're very handsome still.
Very handsome,
still
that's
very
true.
handsome.
See? Something good.
Scott is concerned that Reggie's home-cooked diet might be contributing to his bone weakness.
Would you say that a lot of people that are feeding home-cooked diets, actually, they care very much about their dogs and they're trying to give them the best? And actually, there's pretty dire consequences to getting a home-cooked diet wrong.
It's easy to cook something at home with our best interest of the dog in mind, but absolutely, it can have very, very severe consequences. Absolutely.
At the moment, we can't say definitely what is causing the changes with Reggie, but what we do know is the importance of a complete and balanced diet that has all the vitamins and all the minerals that he needs to thrive. Where we are right now is a CT scanner. It gives us a lovely 3D image and it looks at soft tissue as well as bone, and we know that with Reggie he's got quite a few bony deformities, so that's exactly what we're here to have a look at.
Imaging specialist Avi is interpreting the scans.
The femoral head, which is this one, is collapsed on both sides.
But why there would it collapse of all places?
Because this is where all the pressure is. All the weight of the body is being transferred to the femoral neck.
So there's that quite significant curve on the spine that we can just see when Reggie's moving around. Is that reflected on the x-rays?
This is the spinal process of the vertebra, this area here, and this is the area that I called mottled. It's a bit unstructured, which shouldn't be the case.
Because there is a lot of things that is very strange with this dog's skeleton.
I've never seen a case like that with the cluster of pathologies, the vertebra.
The ribs.
The ribs, yeah. I've never seen such a thing, really.
It's always pretty worrying when you go to a specialist and they say, look, I've never seen anything like this in 20 years.
It's not a straightforward case.
The problem that Reggie has, we just don't understand at this stage. We just don't. We don't know. It could be still so many different things.
So it doesn't fit any one particular condition.
So it seems that with lots of veterinary brains on this, we're still quite stumped. Lots of changes in a skeleton, no clear diagnosis. It may just be that we get the results from the blood tests, but we try and treat in the hope that Reggie responds.
Absolutely, yeah. Once we have the full picture with the bloods, we may have a better idea, but absolutely, sometimes we just need to treat and wait and see.
So what we're going to try and do is run a few more tests. We're going to sample some of his bone to see if there's infection present, and then I'm going to be starting a diet with Reggie just to make sure that it's completely balanced and has everything he needs to be a healthy dog. Hopefully that will work whilst we're waiting for all the rest of the test results to come back.
With hip surgery for Reggie looking extremely unlikely, Scott now has to deliver the difficult news to owner Peter.
Hello, mate. Right, so your dog is quite the medical mystery. Yeah, so there's lots to discuss, there's lots to think about, and it's a very, very complicated case.
Scott's plan is to work with the family to keep Reggie as comfortable as possible and modify his diet to try and strengthen his bones.
All right, Peter, all the best. All right, mate, take care, bye-bye. Peter's concerned and he's worried, but he won't give up and he'll do his very best to make sure that everything Reggie needs, Reggie gets. Thank you so much. See you later. See you later. Bye. Bye. Let's go home, mate. Come on. Good boy.
This is really, really terrible. I don't know how we're going to put that together.
At his practice west of Sydney, Rob is shocked to discover Zazu the macaw has multiple fractures. If the exotic parrot has damaged her wing beyond repair, she may never fly again.
The x-ray shows that there's two bones here, a radius and an ulnar. The ulnar is certainly fractured, but the radius, which is the main bone in there, I think I saw about 5 fragments. It's really smashed. I don't know how this bird's done this fracture, but she's done a damn good job on it. So we'll need to try and just, I guess, pin and wire it. It's not a plating job. Okay. Our plan is to try and put 2 or 3 pins in there, and then maybe some what's called cerclage wire that goes right around the bones, and just bring those fragments in as best we can. Hope that she gets through the surgery because it's quite nasty. We're just getting the bear hugger as well. So getting everything organised now, one of the things that is going to be important is a little bird, warmth is king. So we'll get what's called a bear hugger and keep the warmth going so that we can get through this. As soon as their body temperature plummets, if a bird goes into, they're so tiny, they go into what's called hypothermia, low body temperature. And if it doesn't come back up quickly, they die. Tell you what's going to be worry is the nerve under there, of course. It's a big worry. So our approach is underneath the wing because we can get to the bone easily, but there's a major artery, there's a vein, and there's the nerve running down there. This is very, very difficult. Poor bird. We're warming the humidity crib for her.
Yeah, I turned it off. Sorry.
Right. Oh, well, we should have been done for the day. We should have gone home by now. If this bone is really mashed up when we get in there and it's really looking bad, we may have to amputate the wing. It's horrible. The bird has to learn to balance again, and of course will never fly again. It's very difficult. She'll need a lot of not just physical care, but also some psychological care, because all of a sudden she can't fly, and that's very unnatural for her. Let's do it while we can. Straight down. Yeah, it's really good. And this is not going to be easy at all, is it? Lost a lot of blood because the fracture has just opened the whole of the bone marrow up so much. Birds have a low blood volume, they're only little animals, and so if any loss is a significant amount. You don't have to lose a lot to be a big percentage of blood in a bird. So we've got to be very careful and make sure we don't go nicking any major vessels and having blood loss, because that would kill her. The pins, please. Gotcha, gotcha, yeah. The other one straight in there. All right, let's get this one through first. Even for a bird, the bones are too soft. I don't like that. It's tiny surgery. The bones are fine, they've got air inside them. Putting pins in them can cause the actual bone to fracture again. Our mantra in veterinary science, of course, is to do no harm. Oh, you poor bird. Zazu, Zazu, Zazu. Last one. Gotcha. Beautiful. Done. Okay, you want to close and then we'll take an x-ray.
X-rays will show Rob and Luke if they've inserted the pins correctly in Zazu's delicate wing.
X-ray. Perfect.
And while Zazu recovers in the warmth of the humidity crib, Rob is keen to inspect their handiwork.
I can't be unhappy with what the mess it was in, and then the wire has brought together the fragments. Yes, I'm very happy with this. Yeah, this is veterinary science at its best. You just finish one emergency, another one comes in. Come on, try again, let's have another one. So it's a life of a vet. Tough life, but I love it. Zazu is just squawking away. That makes me feel happy because it means that she's well. The post-operative x-rays look brilliant. Time to go home.
It's unlikely Zazu will be able to fly, even when her wing has repaired. She'll be heading home soon to be reunited with her best friend Diego. In Atlanta, it's almost time for Toby to go home after narrowly surviving high-risk dental surgery. Waiting anxiously to see her much-loved poodle, Andrea spent the day worrying the 15-year-old might not make it.
It was definitely really stressful, again, given his age and his condition. I wasn't sure how he would handle the anesthesia. I was super relieved when Dr. Arvid called and told me that everything was okay. I felt like I could finally take a breath. So yeah, I was definitely very relieved.
Here he is.
Boy, baby. Oh.
Here he is.
Oh my goodness.
Yes. So you see, he's got a little bit of blood from his
yeah.
nose there. And I'm gonna send you home with some gauze,
Okay.
just to kind of blot it. But because of the fistulas in his mouth, the bleeding is gonna be part of it. And the gums, you know, they're very vascular. Yeah. So, but he'll be fine. He will be just fine.
Oh my goodness.
But he did great through his anesthesia. He, you know, handled it like a champ. My biggest hope for Toby is that one, we get this cough under control and alleviated. Two, no more pain, pain-free life. We just focus on managing his heart condition and allowing Toby to give Andrea the love she is looking for the rest of the time he's here. You be good and let mom do what she's supposed to do, okay?
Okay. Long-term hopes for Toby is that tracheal cough can really be minimized, that he'll have less oral pain, and that he'll be able to be a little bit more like himself again.
Thank you so much.
You're welcome. See you later, Toby.
Say thank you.
Time to get you home. Get you some rest, okay? I know. All right, let's go. Come on.
So we know her cruciate's definitely ruptured,
Definitely
completely gone.
In Brisbane, Alison must break the bad news to Sally, whose charity relies on donations, that River needs an expensive operation to have any chance of being adopted.
Okay, Sally, thanks for waiting. She's been very good. Okay. So unfortunately, it's not great news. She has completely torn her cruciate ligament, and that's a ligament in the knee. So unfortunately, it does mean major orthopedic surgery. Right. It's a long road recovery. It's a little bit more expensive than we had hoped.
But Sally has news of her own that means River could still find a loving home.
I didn't know how bad the news would be, so while I was waiting, I had a chat to Happy Tales and we've agreed that we're going to help River. Happy Tales have agreed to cover the costs of River's surgery and rehabilitation, whatever she needs. She's worth it.
Yeah. Amazing news. You guys are amazing. Thank you so much. I think she deserves it.
And who knows, my hope for River is that we can sort out any issues with her leg and she can find a forever home.
Because River is already under anaesthetic, the decision is made to go ahead with the reconstruction of her damaged left knee immediately.
So River doesn't have this operation. She's going to be in pain for the rest of her life. She's going to get secondary osteoarthritis in that leg, which again means more pain. And one of the worst things that could happen is because she's overweight bearing on the good leg, she could potentially snap that cruciate in the good leg as well.
She's done this so long ago that all of the meniscus fibres of the ligament have been dissolved. So simply put, all we're doing is doing a circular cut, rotating the top of the shin bone so that it's relatively flat.
After preparing the knee bones, orthopaedic surgeon Jeff attaches a plate to hold together the reconstructed joint.
We're just going to slide it underneath.
If the repair is successful, River could once again walk normally.
So that's going to fit in beautifully. But that'll make a radical difference to how that knee works. 2 more screws, Alison, and then it's party time.
The surgery is quite intense. There's a lot of drilling, there's a lot of sewing, there's a lot of blood and bone, but Dr. Jeff is amazing at what he does, and that knee has come together really nicely.
There you go, baby.
Oh, hello, good morning. Good morning.
As River recovers, Sally has organised for the 8-year-old's new foster carer David to meet the beautiful rescue dog.
Hi, David. Come and meet your little River. She's just recovered from cruciate surgery.
Oh my goodness.
Oh,
look. You're gorgeous, aren't you? Look at you.
She's really leaning in. I think she knows you are her new dad. She's got a long road of recovery ahead, but I think she's in great hands.
I'm sure she will fit in at our place.
Yeah, she's got such a calm temperament, hasn't she? Hey, do you like your new dad?
She's beautiful.
She
deserves the best life, and she's one very lucky girl.
As soon as David meets River, you can see there is a connection. It's almost like they know that they're supposed to be together, so I can already tell they're going to be the perfect fit.
Oh, look. You know who that is? She is gorgeous.
It feels so amazing to be part of this moment, to be from the beginning, when River's diagnosed, to when she has a surgery, to when she finally reaches her foster family. It's such a heartwarming feeling to know that all these patients that we treat will get amazing homes and live their best life.
Are you going to a good home?
Beautiful girl.
Come on then, buddy. Here we are.
Fingers crossed he's going to enjoy this water.
Yeah.
That's what I'm planning.
In the UK, it's several months since Reggie's CT scan, and Scott and owner Peter have brought the ailing dog for some new therapy an hour east of London.
Come on in, good boy. Yeah, he's been improving. He looks forward to going out for his walks now, whereas before he would sit and just lay there on his bed. He's very happy. Come on in, Reg.
Come on, Reg. Ready, buddy? Good
Come
boy.
buddy. Here you get.
So, Reggie, this is a dog aquarium. Good boy. It's okay, mate.
Well done.
Reggie is having his first hydrotherapy session after tests finally revealed why so many of his bones are malformed.
Good
Well
boy.
done.
Well done. That's it. Reggie is suffering with an infectious condition called osteomyelitis. It's basically infection of the bone, and that explains why it was present in all parts of his body. We've had to use countless antibiotics over the last many months to get the infection under control, but unfortunately, Reggie has suffered catastrophic changes to his skeleton. You good boy. Daddy's just here. Look.
Well done.
It's okay.
He's not one for the water. If we have a shower, he tends to run and hide, but we'll see. Not 100% sure, are you, darling? He's just had lots of problems, and he's been in and out the hospital with it as well. So the hydrotherapy now is really the last resort of getting his back legs working properly. Come on in. Keep walking. Come on. Good boy. Come on.
Good boy.
Yeah, he's not quite sure what's going on, but
hydrotherapy is an absolute must for Reggie's future. If he is to stick around, we need to build this guy up. And if there's any chance of surgery whatsoever, he needs to have the muscle to be able to support the joints when we correct them. Good boy! One small step for Reg and one giant leap for rehabilitation. Well done. Very good. Well done.
I can't believe he hasn't howled.
We can't say for sure if ever he'll be a surgical candidate.
No.
But what we do need to do is to build up what we have.
And a quality of life.
And the quality of life. So by building up the muscles, he'll be able to go outside more and play and enjoy himself. And that is quality of life.
It's all about improvement, and he is improving. With this treatment, once a week, who knows? I'm going to have a drink. For some water. Hey, some drink.
This is the first step of a very long journey for this dog, but I think it's a very positive first step. Yeah. Oh, lovely. Thanks, bud. I really do feel that him and Peter together, hopefully he's going to live as long and healthy a life as he possibly can. Let's go.
Come on in. Thank you.
Thank you. See you later.
Thanks everyone. Come on in, you.
Come on, buddy.
I can see something now. I can see the way it's going to go forward. And yeah, no, I think it's going to lead to a healthy future for him. Very happy.
Scott loves you. Mwah. Good on you, Peter.
Scott, thank you
Good to
very
see
much.
you. We'll see you again soon.
Yeah, most appreciated.
You're very welcome.
Most appreciated.
You are welcome.
Right,
all right.
come on in, you.
Off you go.
See you later.
See you later.
Bye.
Bye.
Everyone, it's me and Toby. Just wanted to give you a quick update and let you know how he's doing after surgery. As you can see, he is thriving, and as you can hear, he is also not coughing. We are very thankful for Dr. Arvid and his team for taking on this challenge. It was 100% worth it. Ain't that right?
And a month after Rob inserted a pin in Zazu's badly broken wing, the young macaw has now fully recovered. It's unlikely she'll ever fly again, but is happy to be reunited with her best friend, Diego.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.